So I've already been grooming Beano for the last hour, but I'm giving him a special kind of treatment. So, yes. I'm giving him a special kind of treatment to solve his issues, which are specific to him as a giant bunny, but I've also noticed he does have some health issues we work on. Alright, Beano? You got a lot of health issues you need to fix, huh? He has a lot of health issues you need to work on. Poor guy. So, bit of background. Beano was rescued from a meat farm. When I first got Beano, he'd never been out of a cage, so he didn't know how to hop, and he would shuffle around on his butt. And it took me 3 days to get the fecal mats out from his butt, his tail area, his hind legs, which were stopping him from moving. And he couldn't stretch his leg, so he didn't know how to hop, and he was very afraid of open spaces, so he couldn't sit in a room. He had to stay in his pen. He was free to leave, but he wouldn't. So we brought Trauma Bunny, this PTSD bunny, to our home, thinking that he would just bond with baby girl because she had a partner, and it didn't happen because he was in too much trouble. So I'm still working on him. He's a lot better now than what he was, but there's the tattoo from the meat farm. He's a giant bunny. They breed giant bunnies in the meat farms for their meat. Pointless breeding a dwarf bunny for the meat. So anyway, I am doing some treatment on him. So I'm going to sit down there and see if I can just talk my way through it. I've got the red light on because he needs that for the skin to heal. I've been doing it for an hour already, but there's still more to go. If I can get the camera to zoom in and show you the area I'm working on, I will, but right now it's connected to the power supply because otherwise I'll lose power. So anyway, see if I can get started. So I'm going to put his butt under the red light. Alright, Beano. And let's just spread his, so I'm just going to grab him under his knees. It's okay. There we go. He lets me do it. He's let me just move the camera a bit. I can barely read, hang on. What's happening here? So my giant bunny just needs some therapy. I noticed that he has a bit of an issue down here on his lumbar plexus. So I'm just going to work on it and get that area to heal. Okay. Ah, that's better. There we go. So I've got the red light warming, increasing blood circulation around there. Just sprayed it with some detangler, which contains a bit of dimethicone. It's harmless. If he chooses to groom it, it won't harm him. And I'm gently teasing on the fur. You okay there? I'm gently teasing on the fur. Just to stimulate nerves and get the circulation happening in this area. He's a giant bunny, which means that particular to his type of breed, his particular breed, they tend to suffer a lot of arthritis issues in this part, near the tail, near the hips area. And I can feel just under the skin where there's a lack of circulation, so that area under the skin has become kind of plaqued up and like almost disease ridden. But we can work on that. All right. Right, I'll carry on. You need to get your legs in position again. Ready? Okay. Just kind of jig it a bit so that he relaxes. Oh. You will do it now, will you? Hmm? Big sigh. Big sigh. Come on, we only just started. Try again. So I get him to stretch out, and then I can get access to this lumbar plexus. There we go. So you're okay. You're okay, Vino. Shall I change my position? See if I change my position a bit. There we go. Try this way. You big bunny. Okay. Let's try this. Okay. I just have to be really patient and do it slowly. And he knows I'm trying to help. I do this a lot. Can you see him? Yes, he's okay. He's okay. Okay, so now I can feel him. He's getting relaxed now. And then he'll let me do it. It's kind of hard for me to describe what I'm feeling because I can feel this in animals and I can feel it in myself. So how to have that sensation? That's difficult. And when I say I feel it, I don't just feel it like tips. I feel his whole body. So I know what's giving him pain. I know where the pain is coming from. But I know that healed. He's only 5 years old. He's 5 years old, and for a giant bunny, that's middle-aged now. He's an elder now for a giant bunny. And giant bunnies tend to suffer with arthritis issues in their backs just because of their morphology. They don't live as long as small bunnies. And I can feel this happening in him, and I just want to fix it because I can give him a better quality of life than he's had. I feel terrible for him because when we rescued him, he had never known life outside of a cage. So he was constantly squished up and he was shuffling around on his bottom. He couldn't hop and he didn't want to hop. He was afraid to hop. And he was afraid of the big room, afraid of freedom. But he's getting there, he's getting there. He's starting to not open up. He's starting to overcome the fear. Overcome the fear. Yeah. Aren't you? Huh? So I can feel he's getting relaxed now, and the lamp is helping. It's getting the blood circulation in there. So that's what I'm doing. I'm jiggling it around. I noticed it last night when I was doing the live stream. I felt like near his lumbar plexus it was all kind of plaqued up inside, and I knew that was the source of his weakness. He has a lot of weakness in his back leg, so he can't stand up and he falls over a lot. So I need to get that strength coming back, but the strength will come back unless we unblock the lumbar plexus, because it's all plaqued up. I can feel it. So to do that, we're going to massage, we're going to get red light on it to heat it up, and then I'm going to stimulate it using the wire brush, just gently. We don't need to be with it, we don't need to rake through and get rid of the mats. We just need to stimulate it so that the nerve sensations come through, exercise the nervous plexus. That will stimulate it to rebuild, to heal, to increase its breadth, and then he'll be able to develop strength in his back legs again. So we've got the lumbar plexus here and the sacral plexus right here, and 2 spots on him are in need of a lot of help. So I'm putting the red light on it to start the process, to get him to heal. And I'm jiggling it at the moment. I'm jiggling it to get the circulation in. Now the funny thing is, I do this on myself. I use the juicy to agitate these areas to get the mineralized plaquing out of the joint spaces. Yes, Peter. You okay? He's okay. He's okay. You're doing okay, right? Yeah? You're doing okay. So we jiggle it up, and then we're going to start stimulating the nerves in absence of acupuncture, or you can do this by, okay? He's happy. He's just, good boy. Good boy. All right. What is it? What is it? You're okay. You're okay. You're okay. Can I nice now? All right, you're gonna let me start now? Huh? Okay, let's see. Good. Right. So this wire brush, it's not just grooming him. I'm intentionally stimulating the nerves in this area. That exercises the nerve highways. So his body will respond to that, and he'll start to heal the nerves, and that will enable him to build strength in his legs. Because he's a big bunny, but he's actually pretty weak. He keeps falling over because he doesn't have the stabilizing muscle strength or the control of the stabilizing muscles. So he'll stand up on his back legs and just fall. And that is just because he was caged for 4.5 years of his life. He was kept in a cage. So those muscles didn't get exercised and they atrophied. And in addition to that, this area around his sacral and lumbar plexus became plaqued up. You okay?
He'll be okay when I leave. He thinks I'm...
Oh, right, okay. So right now he is watching my husband because he thinks my husband is about to give him something, treats or something. So, sorry, Beano. Yes, baby. Yes, baby. What's this? Oh, okay. I'm afraid I can't see the screen to see what the comments are, but I can see a stream of comments. And if I could move the camera closer, I would. It's just that it's a little bit different at the moment. I'd already been doing this for nearly an hour before I started this talk. Oh, I really should share this because I don't know. I just feel so badly for him because he's a trauma bunny, aren't you, baby? You've got life now, but he still has a lot of trauma response. And if I can kind of cure him of the fear that he endures, he'll be able to bond with baby girl better. I can't release too much in one session, because if you release too much in one session, it will just overload his liver, overload his kidneys. So I don't do too much in one session. I have to do this bit by bit. Every time I do it, I give him a little massage, a little stimulation here. There are improvements, but when I first got him, was it 8 months ago? It was really sad. He would shuffle about everywhere. He wasn't hopping like a bunny. Actually, cool. Okay. Getting there, Bean. We're getting there. Okay. I would like to try and bring the camera closer to show you what I'm seeing. I don't want to move and jostle him just yet. Okay. I'm getting close to an area that has healed quite a bit. So this part of his body, he has difficulty reaching and grooming himself. And this is why I'm stepping in to do it for him. But I can't groom it per se, you know, entirely in one go, because it would just be too much irritation on his skin. Yeah, you're doing me well. Huh? You're doing me now. He's starting to stretch his legs out, which is a really, really good sign. I can get in a bit deeper now. All right. This part of their tail on many bunnies gets really matted at the root, and the danger about it getting matted at the root is that the fur can't efficiently de-shed the undercoat, so you end up with this build-up at the base of the tail, which is full of dander, and that starts to break down the fur, and it becomes this felt rather than fur, and then it can cause skin conditions like itching and things like that. Just like any cat or dog would have, I guess. So that's looking pretty good. I do this on my bunnies from time to time because she's an L-bun, so she can't get to the base of her tail and clean it. So I have to do it for her. And bunnies are very cool, but when they get to a certain age and the arthritis starts to set in, it very difficult for them to groom this area, and grooming it is essential for their health. Because when they stop grooming, these nerve plexuses that are here and here start to plaque up. They start to succumb to diseases like arthritis and even kidney problems. Where a bunny kidneys around here. You're doing all right. Hmm? So there we go. He's got a good treatment now. Getting the blood flow to circulate around here and clear around build up under the skin near his spine. And that should hopefully, if I keep it up, enable him to develop strength in his legs again. He still struggles. He's still not as strong as I would like him to be. A, B, no. Okay. Right. This area here needs work. That's why you don't want to stretch your legs, is it? Let's put this on again. So now I'm working on his hamstrings on his left leg. It doesn't appear that he's able to do this by himself. I noticed that there was some pilling at the base of his fur near the skin, which is what starts before the matting. So fur doesn't grow like hair. Hair grows on a single strand, but fur comes out as a group of hairs coming out of like a straw. And that straw, like a toothbrush, as it comes out of the skin, it be clogged with keratin, and if it's growing out with that sign, then I know that the immune system isn't working very efficiently, because it's the debris, if you like, is coming out in the fur, and that's what I'm seeing here. I couldn't get the camera up close to it because it's a bit far away for me to reach, but maybe another time I'll do a close-up of it and show you what I'm talking about. But I see it a lot in her as well, just him. So I look for these areas as a sign of how I can help their immune system. So what I was working on there was don't know if I can get the camera up close to see this, but so his hamstring attachment is pretty plugged up. I'm sorry. It was a little bit too much. Gonna see if I can take this opportunity to maybe zoom in a bit on what I'm doing. Hey Bino. I can feel the red lamp, the heat that it's generating. I can feel the change underneath the skin where it moves. It becomes from like a cheesy sensation where it's kind of hard and plaqued up, and you just jiggle it and it slowly seems to soften up. And that's what we want. We want that to soften up. The skin is not able to move around as well. And it gives him a lot of discomfort. I know what that feels like. And bunnies don't complain. They're quiet creatures. They just retract and they don't move and they don't say anything about it. But I know we're suffering. So I'm softening it. Yeah, you like that, huh? He's purring. He's chow chowing. I call it chow chow. All right. So I've cleaned this area here, and I'm just working down. I can feel there's more here. I feel it under the skin, but tugging on the fur gently and grooming the fur stimulates under the skin and gets it circulating again, so it's all good. It's just an essential part of their immune system. And when they get older and they are unable to do it for themselves anymore, if we step in and do it, it helps. What? What? Right. I'll be more gentle, right? All right. What is it? I usually do this twice a week on both of my bunnies. You're a good boy. You're doing really well. You enjoying that? He's purring away. Gonna spray a bit more. Oh, I'm getting low. It's okay. It's okay, Bina. Okay, I'll be more gentle. I'll have to do the hamstring another day. Hmm? All right. Okay. I'm gonna have to see if I can get in with the tweezers at some point. Because I think the brush is too much. I think I need to I don't know where my tweezers are. I can feel one there. Alright, so I've done what I can in a general sense, but if I'm going to go in and start focusing on little areas, I'll have the camera in closer so you can actually see what I'm doing. So, Beano. I think I'm gonna get the tweezers. Yeah. There's a chunk of fur missing, Beano. Did she bite you in the bum? She bit you on the bum, didn't she? There's a hole right there. There's new fur growing underneath, but damn, she took a chunk out of you. Huh. But you look beautiful underneath. It's growing. Yeah, she won the bum. Didn't she? So I've done his hamstring and now he's stretching his leg. Do you see that? He stretched his leg out for me. Well, that's a relief, isn't it? My white bunny that passed away, he had, on one occasion, he developed an inner ear infection, which caused his neck muscle to tighten up, and he ended up with a tilted head. And like the vets will tell you, oh, there's nothing you can do about it. They're a tilted head for life kind of thing. I was like, nope, I'm gonna fix that. And he let me do the physical therapy on him, and we straightened it out. So there were no symptoms of him having this inner ear infection. It's called a tilt, and when they do it, it's frightening. They can start running around in circles, and they with balance problems, and it's a really scary disease. But often they don't properly heal from it, and but I did the physical therapy on him, and it was as if he didn't have it. So you can do physical therapy on a bunny, but it's different. Yes, baby. You don't like that, do you? I'm sorry. I'm sorry. Okay. Okay, have you had enough? Have you had enough? My big bunny. You had enough? No, don't. It's hot. Can I see you underneath? Okay. There we go. Let's see. Ooh. Okay. Let's move this over. So I'll move closer to the camera. And maybe if I there we go. Alexa, Alec Capybara says, I want him. You're okay, Bino. Okay, let's see what's going on, eh? Okay. Try the other leg. Yes. Let's turn this off, shall we? There. Yes. It's okay. Yes, we know. He's passed out. He looks like he's passed out. All right. Are you back? You don't want your foot done. How's that? Is that better? Certainly easier than yourself all the time, isn't it? Hmm? Are you asleep? He's gone to sleep. He's dreaming. Can you see this? He's dreaming. Mommy. 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 What are you dreaming of, baby? I want to know what you're dreaming about. baby girl. Well, you want to get down? Okay. You had enough? You had enough? You are seeing baby girl, aren't you? Yeah. Okay. Baby girl's here. You wanna play, huh? You okay? Right. You finished now, yeah? Yeah. Come on. Up you come. Oh. That feels better. Yeah? That feels better. Are you done now? Ooh. Finished. Okay, baby. We're done now. All right. Going down. He's on now. One more treatment. Okay. Okay. Okay, Beano, you can go down now. Oh, we've given you lots of treatment now, so you're all good. Okay. Whoopsie.